Now, please welcome with us Dr. Abdalla Alasiri. Dr. Abdalla Alasiri, he is the internal medicine and respiratory consultant, assistant professor, Materji Medical College, head of respiratory and TB unit at Asir Central Hospital. We will be talking about the importance of early diagnosis and treatment of IPF. Please welcome Dr. Abdalla Alasiri.
First of all, I would like to thank the organizing committee to inviting me to be a part of this conference today. Actually, I will talk about the early diagnosis and the importance of the early diagnosis of a patient with idiopathic pulmonary fibrosis, as mentioned by the previous speakers. That the idiopathic pulmonary fibrosis is a chronic, progressive, fibrosing interstitial lung disease of unknown cause. It is irreversible, late diagnosis, and it's rare. And the prevalence of IPF appears to be increasing, although it's unclear whether this reflects the increase recognition on or a true increase of in the incidence. The prognosis is poor, as mentioned by Dr. Muhammad, and despite the development of antifibrotic medications to slow the disease progression, the IPF can ultimately be fatal disease, and early diagnosis is crucial for initiation of treatment and to refer for a palliative treatment and even the early referral for a possible lung transplantation in a specific group of patients. So, as they mentioned, the IPF, it's depends on the clinical presentation. The clinical presentation and specific. Majority of patients, they present with general symptoms like cough, shortness of breath, and which is misdiagnosed as asthma or COPD, which is quite common. Pulmonary function tests, we can depend on high-resolution CT, and a lot of guidelines were created regarding the role of high-resolution CT, which is discussed earlier by Dr. Muhammad. So the most important thing is very important that majority of patients, they are first evaluated by the primary healthcare physicians. And I think increase the awareness among the primary care physicians is very important and crucial regarding the early detection of IPF. So, as I mentioned, that the primary care physicians, they have to be trained regarding the early detection of idiopathic pulmonary fibrosis, and it's very important to train them and create a clear pathway regarding the patients with suspected IPF to refer them earlier to ILD specialized center. We found that in the lung cancer screening programs, they found some of patients, they have a background of what they call it interstitial lung abnormalities, and they create a recommendation regarding those patients to identify or investigate more regarding these abnormalities by high-resolution CT to detect if those kinds of patients have ILD or idiopathic pulmonary fibrosis or UIP pattern. So when you treat the IPF, it is important to start the early treatment because the antifibrotic, either pirfenidone or nintedanib, show decrease in the progression of the disease, especially as reflected by forced vital capacity. And we know that the pirfenidone was evaluated in both capacity and ascent trials, and it show delay the progression of decline in the forced vital capacity, and also in the nintedanib in the impulse trial. So early diagnosis maybe lead to earlier treatment, and even individual clinical trials were not sufficient, because a lot of patients who are involved on these trials was either late diagnosis or have advanced disease. Evidence is growing supporting the effects of anti-fibrotic, decreasing the risk of acute decline in the lung function and improving the life expectancy by slowing the progression rate of IPF. And given the progress of a patient's condition cannot be anticipated at the diagnosis, and considering poor overall prognosis of untreated IPF, anti-fibrotic medication should be considered for all patients with diagnosis of IPF. Futures outlooks, as Prof. Al-Jadea talk about, that there is medications that can now is involved in multiple clinical trials, and involvement of a combination treatment in a patients with IPF by pirfenidone and nintedanib showed that there is increase in the gastrointestinal side effects, but a lot of evidence that is coming supports the using of anti-fibrotic medications. Take-home message: the IPF is a rare disease and can be difficult to diagnose. Access of anti-fibrotic is restricted to a patients known to specialized centers, and such any delay in the referral of ILD will lead to poor prognosis and death, la qaddar Allah. Specialized multidisciplinary team review of a patients and discussion of individuals' risk and benefits of treatment may help the patients with adherence to a medication. Thank you.